Three, two, one. Well, hi there and g'day. Welcome to another training video. This one's called Autism and Medical Care. And if you'd like to know more about what autistic people go through in hospital, please leave some comments down below and/or contact me via the website link that I'll leave in the comment section of this video. And then I'll be more than happy to put them in another training video for you later on down the track. But in the meantime, let's get on with the presentation. The topics of discussion in this particular video are dealing with medical staff, blood tests and X-rays and CT scans, lights and sound issues, being on a ward, Autism and TV Choices, and contacting me if you need any further information. So when an autistic person, depending on where they are on the spectrum and how independent they are and what level they are, they may not cope with having the staff constantly coming into your cubicle to attend to your care. This can be extremely stressing or overwhelming for the person with ASD who's undergoing their medical treatment. The doctors and nurses are actually only doing their job. They want to take your temperature, require some blood tests, so you may need a cannula in your arm, X-rays, CT scans, and sometimes need to do extra tests to assess your situation accordingly. And it can get overwhelming. I know myself when I've been in hospital. It's really hard, really difficult. Sometimes a set of earmuffs or noise cancelling headphones does the job nicely to help block out all the sounds for the person with ASD. But then they wouldn't be able to hear what the doctors and nurses are asking them or telling them, because they may be able to make their own decisions, but they may not be able to make their own decisions. So if the doctors and nurses need to talk to the patient and they don't have that decision-making planning process and they can't make their own decisions, it's advisable in this case for a parent carer to be present with the person with ASD whilst undergoing their care in the medical facility if possible, so that they're able to speak on the other person's behalf if necessary. I'm able to make my own decisions, and if I need understanding or clarification of a question or anything else, I just ask and it's repeated back to me, and then I can give them the straightforward front answer they're looking for. When the person with ASD needs to have a blood test, it can be a positive experience or a negative one. It all depends on the level of autism that the person has, as well as how they handle the situation of being able to tolerate needles or injections in their arms or veins. But for me, I'm used to it. I'm pretty much able to cooperate with all the medical staff, but having those blood tests and injections and things, sometimes it can get to me as well when I'm under their care at a hospital or medical facility. All I want to do is get it over and done with and get out of there. Sometimes even I find it overwhelming and sometimes inundating. Blood tests serve multiple purposes, primarily to assess general health, diagnose illnesses, and monitor existing conditions. They can help detect diseases early, assess organ function, and track the effectiveness of treatments. Blood tests can provide a snapshot of your overall health, revealing potential issues before they cause notable symptoms or noticeable symptoms. Blood tests can also check for levels of cholesterol, glucose, and other substances that can indicate risk factors for heart disease diabetes, and other conditions. Blood tests can help identify the cause of symptoms like fatigue, weakness, pain, or swelling. They help doctors track the effectiveness of treatments and make adjustments as needed. Blood tests can also help assess the function of the heart and other organs, so they're very important to do when a person is in hospital. X-rays and CT scans. When the person with ASD needs to have an X-ray or CT scan or otherwise, it can be either a positive experience or a negative one. Training and preparation for this procedure, as well as others, needs to happen for the person with ASD to help them well in advance to assist them with understand the goings on with their procedure. And then you as a parent carer should reward them with treats afterwards when they've had their X-ray or procedure also. But this also includes medical staff, where if they're not familiar or unaware of how a person may react with autism spectrum disorder, then they need to undergo full training to understand the person's needs and requirements at the time before undergoing their procedure or doing their procedure for them. For myself, as a person with autism, I'm very high functioning. I know what to expect and how to do these procedures and tests, as I'm used to them and I've had many done over my time in life or my lifetime. I've had many done over my lifetime. Whenever I'm there at the medical facility, I'm very happy to cooperate with the staff there as long as they know what they're doing and give me instructions of what to do when they're scanning me in a particular area of my body for it to be medically attended to by my family doctor or GP. X-rays and CT scans are both used for medical imaging to visualize the inside of the body, but they differ in their capabilities and the types of information they provide. CT scans, on the other hand, produce very detailed cross-sectional images of the body, allowing for the visualization of soft tissues, organs, and blood vessels, and are used to diagnose a wider range of conditions, including internal injuries, tumours, and infections. Lights and sound in hospitals. These can be quite overwhelming for those who have sensory processing disorder, autism, ADHD, or any other neurological disorder. For patients that either have heart or stroke issues and need the constant care of doctors and nurses in the ED or emergency department, the constant beep, 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 beep of the monitors for other patients in the area can be an overwhelming experience that the person with ASD just wants to get out of there and not come back, which is sometimes in the case, and some instances that it's happened, as I've witnessed. Sometimes these beeping monitors even drive me mad when I was in hospital and I was sick. I wanted them to stop so I could actually stay there and rest for a while. But the emergency department is always very busy, or sometimes a little bit quieter, but always very busy. However, there are some high-functioning ASD patients who can cope with the inundation of lights and sound going on around them while they're in the ED department as well, or also as being on a ward in a hospital. Being on a hospital ward can be a stressful and unfamiliar experience, often often involving a mix of positive and negative emotions and interactions. Sometimes it can be boring for the person with ASD, or they don't have their favorite blanket or soft toy, or sometimes they're out of their routine and they're stuck in this place with no one to talk to, and they don't have a parent or carer there. But sometimes that can be allowed where the person with ASD level 2 or level 3 may be able to have their mum or their dad there, or some family member who can be of comfort to them, and they can turn to them for support and of love as well. But sometimes patients may feel a loss of control, discomfort, and a sense of being watched. But they can also find comfort and support in the patient community and from caring staff. Most likely the person in the bed next to you can comfort you, and or the medical staff as well. They have a very big dedicated team of people who can support you while you're in hospital also. Shared rooms and interactions with other patients can provide a sense of community and emotional support, but also comfort during their time of stay in a hospital bed. Caring staff. Many patients report positive experiences with nurses and other staff who provide care and compassion. I have been in a particular hospital here in Melbourne, and I've had plenty of procedures in this hospital, and I've been inundated and overwhelmed with staff, but they have been absolutely fabulous, and I get the very best of care at this particular hospital. Structured environment. Hospital routines and schedules can offer a sense of order and stability and predictability, especially for those who may be struggling with their illnesses. Sometimes it's good when you've had an operation, you start getting out of bed and you start walking, or you start doing some sort of physical exercise, or even just walking around the ward can be of a big help to you once you're recovering. Also, for young children with ASD, there's also play therapy wards, which can distract the person from being in bed all day and can be like a starlight room where there's plenty of stimulation, toys and things to do, and uh, things to create, or even just playing games on a computer console or something. There can be plenty of things to do for children while in hospital that they're recovering from their illness. The negative aspects: loss of control. Patients may feel a lack of control over their environment, daily routines, and even their own bodies. Discomfort and noise. The ward environment can be a very distracting place, providing limited privacy and discomfort in shared facilities. Anxiety and fear. The unfamiliarity and potential for unexpected events, such as medical emergencies, can be frightening. Staffing issues. Understaffing can lead to a lack of care and a feeling of being overlooked or neglected in some cases. Loss of personal belongings. Sometimes patients may experience anxiety and distress related to losing personal belongings or having them handled by staff. The experience of being on a hospital ward is highly individual and can vary significantly based on the patient's condition, the specific ward, and the quality of care received. While some patients may find comfort and support in the hospital environment, others may struggle with feelings of isolation, anxiety, and a loss of control. Being autistic, however, can have its consequences of boredom and being out of routine in a hospital bed. Watching TV is very exciting, but there's really nothing much on, really nothing much on to watch during the day or night unless the autistic person is into sports or cooking or reality TV shows that people prefer to watch on air or free TV. Shows on 9Go in Australia show the old TV shows of the 60s, 70s, and 80s, like Bewitched, I Dream of Jeannie, The Addams Family, The Golden Girls, and so on. Predictability. Many autistic individuals prefer shows with clear, consistent narratives and predictable storylines, which can be less overwhelming and more comforting. Special interests. TV shows can be a gateway to special interests, with some individuals developing deep knowledge and passion for specific shows, characters, or themes. Sensory preferences. Some autistic individuals may have specific sensory preferences, such as liking bright colors, specific sound patterns, or particular visual styles, which can influence their viewing choices on TV. Comfort. Rewatching favorite shows provides a sense of comfort and familiarity, helping with emotional regulation and providing a sense of control. Representation. Shows featuring autistic characters or exploring autistic themes can be particularly meaningful for autistic viewers, offering a sense of validation and connection. Here are my contact details. Should you wish to contact me about any other topics of interest in the medical field, please use these details to contact me. And as I said, I'll be more than happy to do another presentation on this for you. But if you'd like to leave some comments, please like and subscribe to my channel. That's KTalk AU on YouTube. And I would be very happy to get in touch with you about doing some autism awareness training and presentations for your company or organisation. Thanks for watching. I really appreciated your time on this video, and I look forward to hearing from you. I look forward to seeing you on the next one. Thank you.